Hello and welcome from the Kashmir Neuropsychiatry Care Center. We provide international and national psychiatry consultation and therapies. I am Deepak, your friend and empath. We are here with insightful and knowledgeable experience sharing on the topic of the day, why young Kashmiris go for suicide. I'm introducing Dr. Saeed Akil Hussain, who is currently working as consultant psychiatrist in UK. Dr. Hussain lead the crisis intervention team in UK to manage acute psychiatry patients in community and reduces the number of inpatients admission. Dr. Hussain has also worked as consultant psychiatrist in Kashmir and was responsible for coordinating 3 MH gap trainings in Kashmir on behalf of Royal College of Psychiatry, London, and has also facilitated the signing of MOU between Royal College of Psychiatrists and Kashmir government. For his contribution in the field of psychiatry, both in UK and Kashmir, Dr. Hussain is the only psychiatrist of Kashmiri origin to be awarded FRC Psyche by Royal College, the most prestigious award in the field of psychiatry in the world. We are honored, Dr. Akil, we are honored to hear you. Will be a warm welcome, Dr. Akil. It will be very nice and proud moment to hear you.
Thanks, Deepak, and thanks for the invitation.
Dr. Akil, let me start with the first question. What is suicide? Why there is too much of hype on it?
Suicide, by definition, means that the intention of a person to act in order to kill himself or herself. The act of suicidal can be impulsive or it can be planned. It can be part of underlying mental illness, or it can happen in a person who does not have any underlying mental illness. In view of the fact it results in the death of a person, it is associated with huge stigma, and that's why we need to address it so that we can reduce the incidence and the prevalence of the suicide in the society.
Doctor, you use this word stigma. Why there is a lot of stigma around suicide? Why people doesn't come up?
Yeah, there are several reasons. As we live in a Muslim-dominated society, and taking one's own life or committing suicide is considered sin in the religion. So anyone who attempts suicide is not acceptable by the society, and they feel that this person has committed some sort of sin. Similarly, it was also till recently a punishable act. So anyone who attempted suicide was punished by the government. Was sentenced and sent to jail. So people were reluctant to tell anyone that their family member has died due to suicide. Suicide on its own has a huge impact on every aspect of the life of a person. Any person who, even if he attempts once, has a psychological impact on his personal life, professional life, every aspect of the life. Not only the person, it has an impact on the family as well. Both the person as well as his family can be both stigmatized and discriminated due to attempt of suicide, and it might be possible that he will be struggling to make friends or getting job in view of the fact that he or she had attempted suicide.
Doctor, is it right? Is it right, according to you, that the neighbors not coming to the family where suicide has happened, they being left isolated? There is a lot of stigma and blame on them. Is it right, according to them, according to you?
I mean, like I mentioned, there are so many stigmatizing factors, and quite a few of them are in the society. So that's why we need to psycho-educate the people, the society, and is a role of both not only the government, all the organization, the community, and the society has to play an active role to reduce the stigma associated with suicide. So we should try to adopt an approach where we'll be providing support and helping the person who attempted suicide rather than stigmatizing him and discriminating him. Because the more the stigma, less the people will come forward to seek help, and we will not be able to achieve our goal of reducing the number of suicides in our society.
You have said it very clearly. Dear neighbors in Srinagar, help the family where suicide has happened. They need you at that moment. Doctor, coming back to you, why the unit? I want to ask you that as a layman, how can a normal Kashmiri will come to know that someone, his loved one or her loved one, will be able to commit suicide, potentially committing suicide?
As I mentioned earlier, that the reasons for attempting suicide that are number one, it could be part of underlying mental illness, or it could be secondly a part of a psychosocial stressor. So any person who has got underlying mental illness, or who is stressed and expresses the wish to end his life needs to be taken quite seriously. He might directly say that he wants to end his life. He might say it indirectly that uh, you might not be see here tomorrow. It's better to die. He might consider suicide as a way of as a way out for his problem, as a solution to his problem. He might be looking for means, like he might be looking for he might have collected medication, he might be looking for rope, he might have be looking for pesticides or fertilizers to use to commit suicide. He might might be saying goodbye to his friends and family member. He might be giving away his valuables to friends and family as a way of saying goodbye. So all these things, all these risk warning signs needs to be taken seriously, and the family member need to support, immediately seek help in order to reduce the risk of that person completing or attempting suicide.
Rightly said. Rightly said. Kindly note, viewers, that most of the suicides have red flags, have early warning signs. You have to just look for them, and you will be able to prevent suicide. Doctor, my next question is why the young Kashmiris are going towards suicide or choosing suicide? Why only youngs?
The rate or incidence of suicide in the young population is quite prevalent, not only in our state, around the world. Looking at the figures given by WHO, in the age group of 15 to 29, suicide is the second leading cause of the death in that age group, of road traffic accident being the number one cause. So that clearly shows the incidence and the prevalence of suicide in the society in that particular age group. Now, to get a better understanding why is more prevalent in that particular age group, we just enumerate the various risk factors that are associated with increased risk of suicide, and that will give us an insight why is it more prevalent in the young age group. The first and foremost risk factor is the barrier to the barrier of access to the services. Clearly, in our society, we have got this political turmoil, so much stress going on. People might not be aware about what to do, where to seek help. They might be reluctant to seek help because of the stigma, which I earlier mentioned. As we are all aware, there are only two psychiatric hospitals they are based in Srinagar, and the rest of the districts only have got consultants who just run OPD. We don't have specialized crisis teams in the district hospital who will be able to provide support to people who have attempted or committed suicide. So that's one of the major risk factors which can be addressed and which needs to be addressed by the government as well as the society. The second factor is that the role of the media. Media has to play quite an important and responsible role. They should not be glamorizing if a celebrity commits suicide. They should not be give description of the suicide. They should not be like identifying the why that person committed suicide. They should not report unusual ways of suicide. They should not be minimizing or presenting it as a way as it is a way of coping of one of the solutions to the problem. They when they are interviewing family members who are bereaved, they need to be quite careful about that. So they might also need proper training. I would recommend that they should be aware, like they need a, like they are recommending toolkits or education package which the journalist should be having access to, in which they are clear about what to do and how to go about reporting suicide. They might even be needing to undergo training. And I would recommend that they should be encouraged to participate in all community programs or workshops that are being conducted to reduce the stigma and to deal with the problem of the suicide. They can play a quite an important role in psychoeducation, like publishing information about coping strategies, the risk factors, warning signs, services available, sharing recommendations made by experts to improve the services, highlighting the deficiencies which needs to be addressed. So it's a quite important role media has to play, especially in the current world. Published media as well as social media, both of them have a significant role, both in prevention and promotion, as well as in treatment, where we can have go online therapies, group sessions, chat groups. All those can help the people and can help both not only in mental illness but reducing the rate of suicide in the community.
Right.
Other
right.
important
Okay, go ahead. Go ahead.
Other important factor that has been highlighted is the presence of underlying political turmoil, which is clearly present in our society. Access to the means of to commit suicide is important risk factor, and clearly evidence has shown if you reduce the access to means, it can lead to reduction in the suicide. People who are discriminated, people who undergo emotional psychological trauma, that increases the risk of suicide or mental illness in young people. Being alone, not having psychosocial support, having conflict, disrupted families, conflict the relationships, losing a family member, having an underlying mental illness, comorbid drug and alcohol abuse, people having physical illness who are in chronic pain, having a family history of someone who has committed suicide, and if a person has attempted self-harm in the past, that's another important major risk factor. So if you analyze the
There
risk
is a lot
factors,
of, it's a long list of risk factors.
it's a long, definitely long list, and if you can analyze them, you will clearly see that most of the risk factors easily fulfill the age group that we are trying to address, that is the young population. So
Okay.
some of them can be addressed and some of them might be difficult, but if we try to work on addressing them, we might be able to reduce the risk of rate of suicide in the community.
So kindly note that it's another point that there are a lot of risk factors, and risk factors are more towards young people. Young people, because of which the young people are thinking for more as an option of suicide. Doctor, my next question is, as a friend, as a relative, as a father, sister, parents, if I know that someone is potentially thinking for suicide, what is my role and what should I do?
Yeah, I think the moment you suspect that someone is contemplating suicide, we need to immediately seek help, which might be that they might be able to call a mental health helpline if available, or if possible, they might need to take the person to a psychiatrist or a mental health team. It's available. And but one thing we need to be clear about that we should not be leaving the person alone. while a person goes out to find help for that person. So we need to involve the family members who can provide support till the person goes out and tries to seek help for the person. We should try to remove the means that are available. We need to see whether the tablets around, whether the rope is around, whether the person is on the top floor, why he might jump from the window. We need to remove the pesticides or the fertilizers, which is one of the commonest means of committing suicide in our society. We need to be clear, check whether the patient is not under influence of drug and alcohol. So then in that he might not be having insight that might further increase the risk of suicide. Like I said earlier, we should not stigmatize it, and we should be not be judgmental. We should not be trying to give lecture to the person or blaming him for thinking about contemplating suicide. We should be listening to the person. It might be his way of seeking help. He might be thinking about suicide as he had no way out. But if we listen to him, that might be in a way sort of way helping him cope with the stress, and that might reduce the risk of suicide. We should not be judgmental, and we should try to be actively involved with the person. We should directly ask the person whether he is contemplating suicide, because there is a myth that asking someone whether you are thinking about suicide will increase the risk. That doesn't happen. In fact, asking the person whether he contemplating suicide might be a way to help forward and reduce the risk of suicide in the society.
Rightly said. Dr. Akhil, you have beautifully explained do and don'ts, what a normal or what a caregiver should do. What I understand is that we don't have to leave the person alone in this situation. We need to counsel them, and we need to be very sensitive in talking to them. Also, if possible, kindly go to the nearest psychologist or the specialist, that is psychiatrist, in your town. Doctor, my next question is, how big is the suicide problem? I mean, intensity, and why would you share some numbers which for Kashmir, so that we can at least we can at least guess that how big is this problem?
Yeah, I'm going to start with sharing the figure from the World Health Organization. As per the WHO, almost 1 million, that's 10 lakh people take their life due to suicide every year. There are more than 1 billion people who are suffering from mental illness, which is a major contributing factor to suicide. And more than 1 trillion US dollars are lost in terms of economy just due to anxiety and depression. So you can see the magnitude of problem, the impact it has on both in terms of economy as well in terms of loss of human life. Similarly, I would like to share the data from India. In India, the reported data is that almost 1 lakh people commit suicide. That's the recorded data. But unrecorded data, as per some studies, verbal autopsy studies that were done in South, have shown that the figures might be 5 to 6 times higher. So more than 5 to 6 lakh people might be committing suicide, but it's not documented due to complexity of documentation, and it might not be reported due to stigma associated with it, because it was a criminal act, a punishable act till recently. Society doesn't accept it. So all those figures clearly show that the magnitude of the problem might be much higher than we see in the recorded documents. Another interesting finding I would like to share is that the rate of suicide in South India is almost 10 to 15 per 100,000, compared to 4 to 5 in north of India, so including our state. So our figures are less, 4 to 5, but we need to be aware that because we live in a conflict zone, and WHO figure showed that the rate of mental illness in conflict zone is 1 in 5 suffer from mental illness, compared to 1 in 14 who live in non-conflict zone. So clearly, the figures will be much higher in our state in view of the fact that we are living in a conflict zone, and the incidence and the prevalence of mental illness will be higher, which in turn leads to increased risk of suicide.
Dr. Akil, would you be able to share some numbers for Kashmir?
Yeah, I mean, then I want to share a couple of studies. I found that there was a study done by Department of Sociology that showed that almost 50% of the people who attempted suicide had underlying depression, and 50% of them did not have any underlying mental illness. Similarly, another study showed that the people who attempted suicide, 20% of them were suffering from comorbid substance or substance misuse.
Dr. Sahab, let me ask you this question very straight. I mean to say, what are the numbers in Kashmir who have met suicide? How many deaths? Do we have some numbers that we can say that this out of 100, 10% of the population, or 4%, or 5%, or 20%? How many percent? What is the percentage population who has gone for suicide?
There might be some studies conducted, but I'm not aware of any study that has been published or acknowledged by the WHO, because I remember when I went to Humanitarian Congress in Berlin for my presentation of the MSF study, they were showing data of suicide in different states of India, but they clearly showed a white area around our state. They had no data from our state. So
my next question, follow-up question is, how can Kashmir government will come to know whether the suicide rates are increasing or decreasing when we don't have the base figures?
Yeah, I think like I mentioned earlier, psychoeducation and prevention and promotion strategies are the important factors. If the people come forward, we will be able to assess the.
Dr. You are dodging my question. My question is that are we as a leadership level or at the Kashmir level, are we serious about this threat which world has recognized as a threat?
I mean, clearly, I think people, as per the government, they have various programs and they have made various recommendations that we need to address this suicide. One of the important recommendations that I would like to share or like to collect data is the formulation of the crisis team in different states. If we have got crisis teams who are trained and who are the first line of contact, so they will be able to gather valuable data around the districts. Because if they want to psychoeducate the people, people will know where to seek help, so they will be able to share information. And in that way, that's one of the option to collect genuine data. But definitely, like mentioned, it is a big challenge in view of the stigma and other factors. It's not an easy thing to do, but this can be one of the way out, establishing teams around the district, all the districts who might be able to give us the relevant data. It's not only data, we might be learning valuable lessons which we can implement in the strategies, in the policies, which in turn can help us reduce the suicide in our society.
So how, it's a very emotional question that what is the effect of increasing suicide rates to the normal community, to the normal Kashmiri families? What will happen if the suicide happens in a Kashmiri family?
Yeah, I think it's quite distressing. We already are stressed due to underlying psychosocial political turmoil that's going on in our community. So on top of it, if someone commits suicide and family might be feeling guilty that they were not able to provide help or provide support, they were not aware about it or it was not available, and might be feeling guilty about it, that they might have, if they have the knowledge, they had the information, they might have been able to save the family member, so that they will be living with a feeling of guilt for the rest of their life. The second important factor is that definitely in view of the fact that it's stigmatized both in terms of religion and culture, there's another factor. So even though they are distressed, they might not be able to even share it with their family member. So they, rather than seeking help or comfort or being a grieved family, they might be worried and stressed that they will be now stigmatized and discriminated rather than receiving support in view of the fact that they had lost a loved member of the family. So that's why I would recommend that it's a role of the community. There are community leaders around when this sort of incidents happen in the society. They might take a stand, they might provide support to the family, they might become a role model. Similarly, religious leaders. So the community comes forward, they take a stand, provide support to the family who has attempted suicide. That might help them to cope better. And in turn, that might even reduce the risk of suicide in people
You mean to
who
say
are attempting
community
to
needs
die.
to come up?
Community definitely needs to come up. WHO has clearly devised guidelines, a training module called Community Toolkit, that is specifically a training workshop just for community. They have this a full. I can share it with you. It's called Community Preventing Suicide, a community toolkit. So where they want to use it in the community. So the community themselves takes responsibility and helps the people in the community to deal with the problem of suicide.
So do share with me the soft copy. I will upload it in the discussion part. Uh, uh,
Definitely, I will.
Doctor, as you said, the community needs to come up. And I also like to say, hearing you out is don't take any risk for the teenage students and the young people if they are giving you any sort of threats or sort of saying that they are thinking for death or something. Take psychologist and psychiatrist help. Doctor, coming back to you, my next question is, as you said, you uses the word fertilizers. I also remember in my college days, there were some people who who tried to commit suicide through some taking some poisonous substances. Would you explain us what is the most common means of committing suicide in Srinagar or Kashmir?
Yeah, I mean, with regards to the means of suicide, it depends on the availability of the means. Like in West, people resort to hanging. Similarly, in states, because we have got easy access to firearm. Firearm is the major cause of or means of committing suicide. In developing country, including our state, taking poison in the form of fertilizers or pesticide is the most common cause of suicide in our state. The only positive thing in this is that it is if we reduce the access to the fertilizers or to the poison, it can clearly lead to reduction in the rate of suicide, as was clearly shown in a study that was done in Sri Lanka, where they banned the toxic pesticides, leading to the reduction of suicide by 50%. And the and the data showed that the rate of suicide dropped from 40 per 100,000 to 10 per 100,000. So working on reducing the access to the fertilizers can be a way forward. And it has been, there are certain innovations that have been tried in southern India. I remember when I went to attend the launch of the first suicide report October 10 to WHO headquarters in Geneva. I met Professor Vijay Lakshmi. She was working in the south, and she told me that they had started two innovations. One was formulating what they call as a pesticide banks. What that means is that once the farmer uses the pesticides or the fertilizer, rather than taking them back home, they take them to the panchayat, where they got lockers, like we got lockers in the bank, and they lock them in the panchayat. So when any family member impulsively trying to kill himself, and so he doesn't have easy access to them. So by the time he tries to find it, or he have to go out, it is possible that he might have received support, or he might have changed his mind, which might would save his life. And the data has clearly shown that it has resulted in the reduction. That's why I think they started in Karnataka, then it was then also adopted by Tamil Nadu, another state, after they saw the results in the Karnataka. Similarly, another important innovation which she was responsible for initiating was uh, what we call a super supplementary exam. As we are all aware that in our society, when the results come out, candidates who don't pass exam, they get stressed. I mean, they are worried about their career. They are worried that they might be losing their career and all this sort of stuff, and end up impulsively taking overdose. Quite a few of them take poison, fertilizers, and resulting in the death of these children. So what they have done is that if a child or a student fails in 2 or 3 subjects, he is able to sit in a super supplementary exam 3 months after failing the exam. So if he passes those subjects in 3 months' time, he can join the regular class without losing any year, and which in turn has also shown in the reduction in the number of attempted suicide in those few states. So those are the two innovative strategies which have been successfully adopted and which can be implemented in our state as well.
Very innovative strategies you have shared, Dr. Saab. Dr. Saab, in which year you have met that?
I mean, the launch of the suicide report was in 2016.
Okay.
When they first launched.
Today is 2020. Are you aware about that Kashmir government has opted any of the suggestions like this or recommendations, and they have done the same way that Chennai?
I have not. I mean, in fact, what I did when I came back, we submitted a formal report to the government with the recommendations, in which I include these recommendations. That report is published in the form of a paper. It's available online. It's Mental Health and Youth of Kashmir. So people can just Google Mental Health and Youth of Kashmir. They will see that entire paper in which I have shared all the data as well as the recommendations to help the youth of Kashmir. So which includes, it was basically circulated to previous government, including the CM and all 7 of her cabinet ministers. I sent it to them with the recommendation on behalf of WHO and Royal College, so that they can take those recommendations and try to implement them, which in turn can contribute to the reduction in the rate of suicide in our community.
Dr. you have actually pinpointed the young children's problem. That is, one is failure, that they need to learn to accept failure. Doctor, my another point is about rejection. So nowadays there is a lot of couples, the girlfriend, boyfriend, and because of some rejection they committed suicide. So what's your message to these children?
I mean, like I mentioned, definitely there are psychosocial stressors, and usually what happens that if people are aware of coping strategies, positive coping strategies, if they so once they are quite stressed, they don't know how to react, and taking an overdose seem to be, or trying to self-harm seem to an easy way sometimes to seek help. Sometimes people take overdose to seek help. Unfortunately, because of the severity and lethality of the poison, they in fact don't want to die, but end up dying due to the toxicity of the underlying poison. So that's why reducing the access to lethality, even if they try to harm, that might not, at least that will, they might be saved and might not die. So being aware about the support that is available, being aware of the psychosocial coping strategies, they need to be aware about that, how to deal with the problem, seeking help from the family member, seeking advice, and speaking to family members. So definitely, like I mentioned, society has a role to play. The more the suicide attempt is stigmatized, less we have people aware of the help available, the less the number of services. It basically seems that the person might be contemplating seeking help, and it might be that he might not see any help around, and that might be the only reason that might force him to become completely hopeless, and thinking that because I can't see any help around, no one is helping me, I am stigmatized due to illness or due to underlying problem, so this might be the only way out. But if the help is available, that person rather than resorting to self-harm or trying to harm himself might seek help, and that might save his life.
Rightly said, Dr. Sab. I also like to share you one story of mine. I was very young, and I proposed as a girl, and unaccepted. I got an rejection. I was sitting in a coffee shop, and because I was thinking that what has happened, I call my best friend. And moment the best friend comes, I told him the story. He told me, you should you should kill yourself. Now my question is that if my friend is saying this, is it my good friend? Of course not. If I tell you that my friend was not existing, it was my mind who was saying me that you should kill yourself because you got rejection, my mind is also not my good friend. My mind is a very moody friend. Sometimes it's with us, sometimes it's against us. You need to validate your thoughts every time. Doctor, coming back to you. Doctor, what are the recommendations at WHO level? What are their targets? And same, what are the targets which Kashmir government has taken on suicide?
With regards to the WHO recommendations, I would highlight four main points as part of the WHO Mental Health Action Plan, which they are planning to implement from 2013 to 2020. And in that, they have clearly set a goal to reduce the suicide rate by 10% by the end of 2020 and reduction by 1/3 by 2030. Of the four major components of this action plan are: number one, they recommend strong leadership. So leadership who will be leading from the front, trying to implement the policies, making recommendations to the government, taking expert advice seriously, mobilizing resources, involving the community. Like, it's not only the government, we need to involve the government, the private, invite the private sector, involve the NGOs, involve other professionals like religious leaders. Like in our society, if we see quite a few of our people, they do go to spiritual healers for help for the underlying mental illness. So it's important that the spiritual leaders they are taken on board, and they should not be seen, or they should not be seeing mental illness as something as a competition. So we should be working as collaborators with the, so that they should be clear what their role is, uh, to what extent they will be able to provide support, and when the person should be referred to secondary care or tertiary care services for support. In fact, let me share that when I went for my first meeting with Professor Sue Dame Bailey in London to take the proposal of sending a team for MHGAP training to Kashmir, one of the things she clearly said to me is that, Dr. Hussain, please ensure that faith healers are involved in the MHGAP training. We have been doing a few training, like remember last year, Dr. Muzaffar, who is the director of Police De-Addiction Center, he got, in collaboration with one of the NGOs, I think they got 30 or 50, 60 faith healers, and they specifically trained them in regard to drug and alcohol addiction, what advice to give to the people, especially during the Friday sermons, when almost the entire community, Muslim community, goes to attend the Friday sermon. Similarly, Royal College took a team to Myanmar under Dr. Sophie Thompson, who came to Kashmir as well, and they specifically trained just monks. That entire training was specifically focused for the monks of the Myanmar. WHO similarly has highlighted the role of spirituality, that spirituality should be incorporated into any any program or any training program, any implementing program that they recommend. And they also recommend that we need to take on board the local cultural factors. We just don't need to replicate and just copy the strategies that are used by the West. We need to learn from each other. We did a MH gap training, and in fact, it was published in the British Journal of Psychiatry, the leading news journal of psychiatry in the world, that the topic was what licensed psychiatry can learn from MH gap. What I mean licensed psychiatry, the field, like I mentioned, is the psychiatry team that works in the district hospital. So any person who's admitted with suicide, the license team, once he is physically fit, then the license team comes and they assess him and then decide what needs to be done. And this article available online, and they have taken good points from our training from the MH gap, which they feel can be implemented in the West as well.
Rightly said. Doctor, after committing suicide, as a layman in Kashmir, what are the type of sports which we should give to our loved one who has committed suicide?
I think the first and foremost thing, anyone who attempts suicide, the first and foremost thing we need to do is we need to take him to the hospital, because
Which
if he
hospital,
takes self-harm, it is best. Let me. If it is it can be a simple cut, then that can be taken to the maybe PSC. But if the person has taken poison, we need to take him to the hospital where there are minimum facilities, which means that the team there who's working, they should be aware of the signs and symptoms of the poisoning, the poison the person has taken. They should be trained in CPR. They should be able to maintain the airway or intubate the person if needed. They should have access to IV atropine, which is used for some of the poison, and similarly IV diazepam, which can be used in case of seizures. Similarly, the results of the studies have shown that if we provide psychosocial support in the emergency department, it has led to 20% reduction in the rate of suicide. And what I mean by psychosocial support is that it's the basic principle of the psychosocial support involves, number one, that we need to start with the maintaining confidentiality and respect the privacy of a person. So if possible, he or she needs to be talked alone, not in the group where there will be 10 people standing around and the person will be trying to provide a psychosocial support to that person. With regards to the content of the psychosocial support, we need to be sensitive and try to discuss with the person the the reasons why he should, what he wants to achieve in the life, the reasons to live for. Similarly, going with thinking about or going over with the coping strategies that the person has used in the past, because definitely he might have been stressed in the past, he might have resorted to some positive coping strategy, reinforcing those coping strategies so that they can be used to cope at that time, because he's quite distressed at that time and in the future as well. Similarly, the principles of problem solving techniques, where they go over, enumerate the problem that the person is having, prioritize them, then identify the problem which he feels needs to be addressed at that time, and if it can be addressed, brainstorming various strategies that can be implemented and trying to implement those strategies. Being aware of the resources available in the society, in the community, they are like what are the activities that he can do involving sports or any other activity that he likes, that he can have access to. Activating the psychosocial network involving family members. If the family members are around, they can provide support, like friends, some of the people, they say they like to go to the family, their nephew, nieces, or relatives. So activating the psychosocial network can play a quite important role. Similarly, if the person is even treated or given some medication, and suppose he is assessed, and if we find that he has got underlying mental illness, then he definitely needs to be referred for assessment by the psychiatry or psychiatrist. And if they give a medication, they need to ensure they give a medication that is least toxic in overdose. And even the family might need to take responsibility for dispensing the medication rather than leaving it all with the patient, and he might end up resorting to overdose with the same medication that is meant to cure the underlying illness. So all these are the important strategies that we use in the West that people might be using here, and that needs to be implemented on ground. And all these strategies can be part of the, like I mentioned, the crisis team, which I mentioned earlier, and which can be established in all districts of Kashmir. They can be part of the hospital, so a part of the emergency team who are dealing with the physical aspect of the overdose or the physical injury, and they can be it can be all incorporated into it. It's clear evidence that they can be trained, and people in the primary health centers on the community can provide help and support to people suffering from mental illness.
Rightly
Like
said.
you mentioned, like you mentioned earlier, we did 3 trainings, and we got almost 10 to 15 consultants who were specifically trained in WHO device module or MH gap. The aim of the MH gap is to reduce the gap between the service need and service delivery, because we don't have many psychiatrists. The workforce is only 1% in the whole world in mental health. We have got $5 per person available in our developing country compared to 50 in Western countries. 5 beds per 100,000 in our society community compared to the 50 beds in the West. So that training program, it was conducted in collaboration with Director of Health Services. Dr. Salimur Rahman was the director at that time, and the doctors and nurses were deputed from all 12 districts of Kashmir. It was a 2-week training program in batches. In 2013, we conduct, and along with doctors, we also got nurses, psychologists, social workers, teachers, police professionals. So all those professionals who are working on ground.
Good work,
And
Dr. Akil. Good work, Dr. Akil. In the closing remarks, I want you to say some words to address the people of Kashmir.
I mean, definitely, I would like to share we need to be hopeful. We need to activate. Already, people we are suffering from political turmoil. On top of it, we had COVID-19, so things might be might not be good. It might be quite stressful. Clearly, loss of job, loss of finances is one of the important risk factors for suicide. And even in the studies in Kashmir that have been done, people have highlighted this one of the major stress factor, worrying about resources. So being aware about the resources around, aware of the psychosocial support that is available and trying to seek help and not trying to cope on their own if you are feeling depressed, anxious, or are feeling suicidal. So not losing hope. I mean, I remember my daughter, she published an article in the local newspaper about COVID-19 guidelines for children. And she quoted one letter that a husband had written to his wife in 1920 pandemic, in which also millions died. And in that he had, we said that although there's a dark cloud all around, between the dark clouds, I can see a ray of light coming. I am just focusing on that, and hopefully it will pass. And that's exactly what happened. So we need
after
to
every night there will be a day.
We need to be hopeful, and we need to realize that humanity has always been resilient. We need to take care of ourselves, take care of our families, and hopefully we will be able to get over this problem and try to meet and address the challenges that we are facing at the moment.
Thank you, Dr. Akil. It was very proud to talk a knowledgeable person like you. In the closing remarks, I want to say to the people of Kashmir that it is okay to say that I am not okay. It's okay to be vulnerable. It's okay to seek help. Thank you very much.
Thank you, Deep. Thank you.